Do you understand the risks of total hip replacement surgery? This is the second presentation for patients contemplating total hip replacement surgery. This presentation covers some, but not all, the risks and possible complications of total hip replacement surgery. This presentation is not meant to replace formal information leaflets or the appropriate face-to-face consent process, which is tailored for your individual risk factors. Complications of total hip replacement surgery. The vast majority of total hip replacement procedures go without any complications. However, a small minority of procedures suffer from complications either on the day of the operation or in the post-operative period. It is important that you consider and understand the risks before embarking on replacement surgery. All patients are at risk of developing complications. However, pre-existing health problems, being overweight, and increasing age generally increase the risk. Cardiac, respiratory, cerebral vascular accident complications. A perioperative myocardial infarction, otherwise known as a heart attack, is a known danger associated with the stress, blood loss, and drugs administered at the time or after the hip replacement. A cardiac arrhythmia or abnormal heart rhythm can be very minor or very serious and occasionally results in death. A stroke can occur during or after the procedure. This is thought to be due to changes in blood pressure and heart rates. A post-operative chest infection, often called a post-operative pneumonia, can occur after the operation. This may be minor or very serious. Infection complications. Infection is always a serious risk of surgical intervention. To lower the risk of this, we perform a thorough preoperative assessment to ensure no active infection is present prior to the operation. The operation is performed in a filtered air theatre known as a laminar flow theatre, and this ensures clean air is passing over the operation site. Exhaust suits are worn by the surgeon, surgical assistant, and scrub nurse. These try to prevent any infection or contamination being transferred to the wound area. As well as meticulous soft tissue handling and careful surgical technique, antibiotics are used during the surgery to lower the infection risk further. Venous thromboembolic events, known as DVT and PE. Total hip arthroplasty is associated with the risk of developing a blood clot in the legs known as a deep venous thrombosis. The clot can break off and dislodge to the chest, where it can cause the very serious and occasionally fatal complication of pulmonary embolus, or PE. We try to prevent this by a number of methods, including early mobilization, compression stockings, in some cases compression pumps. We also thin the blood, either by using heparin injections or special blood thinning tablets known as direct oral anticoagulants, usually for 28 days after the operation. Bleeding, hematoma, vascular, nerve, and wound complications. Veins, arteries, and nerves run close to the hip joint. Rarely, when a hip replacement is inserted, one or more of these can be damaged. This can give a minor or major complication, and in some cases can be life or limb threatening. Occasionally, the sciatic nerve is damaged, and this results in a temporary or permanent foot drop. The wound can often leak a little blood at first after the operation. However, occasionally this can be troublesome and require surgical intervention. A collection of blood can develop around the hip, known as a hematoma, and sometimes this requires surgical drainage. The hip wound usually fully settles by 14 days, but can take longer in some cases, especially if bleeding issues or infection have occurred. Weakness in the muscles around the hip. After total hip replacement surgery, it is not uncommon to have weakness in the muscles around the hip. This is why crutches and sticks are used at first after the procedure. The vast majority of patients don't need the crutches or sticks after several weeks. However, a small minority of patients need 1 or 2 sticks long term due to persistent muscle weakness. Leg length discrepancy. The majority of us do not have exactly the same length in each limb. Often the arthritic hip gets worn and shortened. This can lead to a mixture of a true or apparent leg length discrepancy. At surgery, we try to restore the ideal leg length, but a small variation is often seen. For the first few weeks after the operation, a mixture of perceived and true leg length inequalities will be felt. Types of hip replacement. Multiple types of hip replacements are available, including cemented and uncemented, metal or ceramic head, polyethylene or ceramic cap. Depending on your past medical history, age, gender, occupation, and activity level, the type of hip will be selected that is appropriate for you. Ceramic fracture and squeaking. Ceramic components have the potential advantage of reducing the wear rate of the hip replacement. Unfortunately, they also have the disadvantage of ceramic fracture, of the ceramic femoral head, or the ceramic liner. Some patients also report squeaking if both the head and liner are made out of ceramic components. Wear and loosening complications. A hip replacement will usually perform well for many years, but will eventually show signs of wear. Microscopic wear particles will cause an inflammatory reaction that can eventually cause loosening. Revision surgery may be indicated. Ongoing pain, trochanteric pain, and new bone formation. Most patients are pleased with the pain relief the hip replacement gives them. However, there are a small minority that still complain of significant pain. This can be from the muscles around the hip, inflammation of the trochanteric bursa just outside the hip, or calcification of the soft tissues around the hip. Complications resulting in death. Very rarely, a complication such as vascular damage, nerve damage, or infection can cause such a severe reaction that removal of the hip joint or amputation is required. This is very rare, but can and does occur on occasions. Death can occur from complications of surgery. The most likely complication to cause this are a heart attack, cardiac arrhythmia, or a pulmonary embolus. Reducing the risk of complications. We do our best to reduce the risk of complications by performing a thorough preoperative assessment, perioperative antibiotics and DVT/PE prophylaxis, good operative surgical technique, careful perioperative monitoring, and rapid rehabilitation. The risks will be minimized, but they are still present. Questions. Please ensure you are happy that all queries and questions are answered before surgery.